My name's Kate Grayley. I work in the Fleming Initiative, and on behalf of both the Fleming Initiative and CAMO-Net, we're really delighted to have you all with us this morning to think about creating antimicrobial stewards of the future and education sort of on a global scale. We've got an amazing programme of speakers and panellists, and really hope this is going to be an inspirational and quite insightful 90 minutes of content. And I'd also just really like to thank the World Health Organization for all their support in delivering the webinar this morning. I think everyone's joining as attendees, so cameras and mics will be off by default, but if everyone could just make sure that that's the case throughout, that would be fantastic. And we'll have opportunities to ask questions at both the end of sort of our showcase of educational initiatives and then at the end of the panel. So if you can please submit those via the question and answer function. If you have any problems with that, please just put them in the chat instead, and we will keep an eye out for them. And so to open the webinar, I would just like to introduce Professor Alison Holmes, who's the director of the Fleming Initiative and the lead for the Centres for Antimicrobial Optimization Network, to provide us with some opening comments. So over to you, Alison.
Thank you. Thank you so much, Kate. This is really exciting. It's wonderful to be having this webinar, and welcome to everybody. And thank you all for joining us. I think this is one of the most important aspects of addressing antimicrobial resistance, which is engaging the young. I think it is so important that we think about this, and we think about this systematically, and we think about how we can do this globally. So the importance of educating our children and young people is going to be more and more important, because the kind of continued attention to this requires societal engagement, continuity from societal activism and awareness. It cannot be limited to political cycles. It needs to be driven and supported by all of us. So this is really exciting. It also was recognized in the UN General Assembly in New York in September, when the declaration was signed, and there was a particular action around exploring how the world could embed awareness around antimicrobials and antimicrobial resistance into primary and secondary education. So we're picking up that gauntlet, and we're going to be trying collectively to address that with experts from around the globe, some of whom are joining us today to begin this journey in thinking about how we can do this best. So we're wanting to take this not just as a reflection on what's going on, but actually to be turning this into action. And we're going to need all of us working together to think about how best to do this. So the aims of this webinar, as Kate said, there's going to be some amazing examples shown from people around the world in terms of what's already being done to engage and educate the young. Also what people are doing in terms of influencing education, and some of the activities for the very young as well will be included. And the other thing is, I think for people working in AMR to be kind of stuck within their own small bubble is really not enough. We have to learn from people who have influenced change and awareness. And so we're really delighted that we're going to be learning from experts from climate change in terms of how to make sure that there's awareness, and I hope some activism from our young people and our citizens. So there's a lot of work to do. And I think this is only just starting. I think having this discussion will actually start paving the way for how we think about this, how we can learn from what's already being done, but how we can also review what's going on out there, learn from it, and turn it into something tangible so we can actually address that action point around ensuring that this is in primary and secondary education in a meaningful, appropriate, and engaging way. So thank you all for joining. It's really wonderful to see you here. I would like to echo Kate in thanking our colleagues in WHO also for supporting this. And back to you, Kate.
Oh, thank you so much, Alison. So I'm now delighted to kick off our showcase of educational initiatives for AMR in children and young people. So we've got 3 speakers for you who will each in turn speak about their own initiatives, and then there'll be opportunity for questions after all 3 talks. So I'd like to start by introducing Donna Lecky. Donna is the head of Primary Care and Interventions Unit at the UK Health Security Agency and holds honorary lectureship positions at Cardiff University and Imperial College London. With a background in microbiology research, Donna moved to the Public Health Centre in 2006, working in communications, research and intervention development capacity. So Donna, I'm going to hand over to you.
Thanks, Kate. Can I just say that I've just got chucked off? So if it happens again, Kate, I know we're tight on time today, so can you just continue and hopefully it'll not happen. So thank you. I'm presenting on eBug today, and I just want to say I'm presenting on behalf of the amazing eBug team that we have and also the wider eBug partnership. So although it's me today, I'm talking on behalf of a lot of other people. Next slide, please, Kate. eBug was established in 2006 and funded initially by a DG Sanco grant from the European Commission. The eBug partnership comprised of 18 EU partner countries at that time, and the main objective of eBug was to reduce antimicrobial resistance by educating the users and prescribers of the future. And to achieve this, we carried out a number of tasks. We looked at the educational structure and curriculum across each partner country. It was really imperative that whatever we developed was embedded into the national curriculum. We held workshops with educators and experts, and we ended up developing resources for ages 7 to 13-year-olds. These were translated and rolled out across the collaborating and associate partner countries. Since then, the resource has been completely reviewed and updated and is now operated by UK Health Security Agency and is a health education resource for children aged 3 to 18 years. So we've expanded the remit over the years, and it's currently primarily aimed at the educators. Topics focus on microbes, the spread, treatment and prevention of infection, and antimicrobial use and resistance. And our ambition is to reach every child and young person in all communities with messaging on infection prevention and control and antimicrobial stewardship. And we do this in order to promote behaviour change in the antimicrobial users and prescribers of the future. Next slide, please. Throughout the years, eBug's been going on for a long time. It was launched in 2009, and throughout the years, we've carried out various evaluations of the eBug programme. And findings show that educating using eBug not only increases student knowledge in these topics, but also increases teachers' confidence to teach these topics. Many teachers, particularly in the primary school sector, don't come from a scientific background, so it really helps boost their confidence. But more importantly, however, students report enjoying learning using eBug. A recent evaluation in Norway, one of the students said science used to be boring, but now it's fun. So I think that's a great testament. And I need to also highlight that eBug supports educators to teach the national curriculum content. We're not asking teachers to deliver anything new in what's an already packed schedule. eBug is designed to align with national curriculum and provides teachers with resources to support that curriculum content. Next slide, please. We have a few underpinning principles that are a common thread through everything we do and guide our direction of work. Our international partners also follow these principles to ensure that across countries we achieve our objectives. I'm not going to go into these in detail for the sake of time, but what we try and do is eBug supports national and global commitments. All of our materials are evidence-based, and we take an end-user approach to the development of the materials. And we also develop materials in collaboration with many, many other people. So multi-sectorial collaboration is really important for eBug. Next slide, please. I'm just going to show you a little bit about eBug. So if you could play the video, please. Okay, next slide, please, Kate. I think that video gives you a little idea of what eBug is and showed it to you much more eloquently than I could spend 20 minutes telling you. But this shows you that there are 4 teaching packs for educators that are designed around that learning journey that the video just showed you. And the resource includes age-appropriate lesson plans, etc. And it just shows you that the learning follows through from early years, so age 3 all the way through to age 16 to 18. Next slide, please. The pack layout is very simple. It clearly states where the curriculum links are, the learning outcomes that are available there. It details all the resources that are required. We've got health and safety in there, which is a requirement in the UK. And then the detailed lesson plan. Next slide, please. And here you can see we've got some worksheets that are linked into each lesson plan. And these are available to either photocopy in a hard copy pack, download from the website, or to use in PowerPoint. Next slide, please. This is just a brief overview of how our resources build on knowledge as children progress through their school years. Using the hand hygiene resource as an example, you can see from age 3 to 5 years, we teach children how to wash their hands all the way through to 14 to 16-year-olds, where it's about reinforcing the need, method, frequency, and importance of hand hygiene and building this into the wider curriculum. Next slide, please. eBug is an accessible website, so like I said, everything is freely available to download from the accessible website. And we also have YouTube videos which show teachers how to deliver each of the lesson plans if required. Next slide. This just is a slide to show you that we haven't just developed the packs and then stopped. You can see from 2006 all the way up to today, everything in blue is the core resources for schools, but in black you can see we had developed interactive science shows. We established a Guinness World Record in 2012. We've got resources for community groups as well as teacher training resources. And currently we're working with our Caribbean partner countries and European partner countries to develop some vector-borne disease modules. And we're also developing resources for after-school clubs. And then this last slide is just to show you that global visits to the English eBug website over the last 12 months. So we can see that it is being accessed from across the world. Thank you very much. Any questions? Or are you just moving to the next person?
Yeah, we'll move on to the next one, if that's all right, Donna. Thank you so much. It's particularly amazing to sort of see the evidence of the children enjoying the learning and how that aligns with existing curriculum already, and amazing to see the global reach of it as well. So thank you for sharing all that with us. I'm now thrilled to introduce Damilola Adesuyi, the Stop Superbugs Squad team lead. Damilola is an early career public health microbiologist utilising the One Health approach to combat AMR through effective risk communication, community engagement, and research. He currently works as a public health programme officer at the One Health and Development Initiative, where he has led and contributed to several risk communication and research efforts. So over to you, Damilola.
Great, thank you for the introduction, Kate. Good morning, everyone. My name is Damilola Adesuyi, as introduced, and our project focuses on African youth, contributing towards empowering them to communicate AMR. Next slide, please. Recently, bacteria-resistant to colistin, a last resort antibiotics, was found in neonates and mothers in Nigeria, and that shows the burden of AMR when it comes to local communities in Nigeria. And we believe that it is best to change behavior through effective risk communication, which is why we want to engage youths, which are pioneers of social change, to be involved in educating, advocating, and also act to prevent AMR prevention and control. Next slide. So we intend to target 4 main things. So number 1 is to get African youths to be involved in AMR prevention and control. The second is to build their capacity to communicate AMR using audience-specific messages, which is very key because it is one thing to encourage youths to communicate. It's another for them to communicate effectively. So what we want to do is to give them the knowledge to do so. And we also want to support youth innovations. We know youths are quite innovative. We want them to be creative about the ways they want to communicate AMR to persons and different audience. And we're also hoping that this also affects health communication generally and community engagement in African communities. Next slide. So we've done the phase 1 of this project currently for the while, And what we did was that we had 4 hours of expert-led training. The training included 8 modules and breakout sessions, of course. We had 30 minutes per session training. And the training, the participants or the champions were exposed to different modes, including AMR and One Health, gender and AMR, the use of effective risk communication in AMR, the need for policy advocacy in AMR, the use of audience-specific engagement, and several other modules, helping them to see what is necessary, including social and behavioral principles that are necessary when it comes to risk communication. And aside from training them or empowering them, educating them to communicate well, we also provide technical and financial support for all our champions to carry out their intended WOW activities. Several of them have started already. We've had champions that have gone to registrations to talk. We have champions that are going to schools, secondary schools, institutions, religious institutions and communities, and several other target audience that I'll be mentioning later. Next slide, please. So this is a picture of the training sessions that we had, about 4 of them. Some relating to introduction to AMR, some about One Health and AMR, and also how best to communicate AMR using digital media. Next slide. Now, another thing we promoted during this training session is that we want our champions to reflect on what they've gained and share with other people, because we believe they have their own network and we want to have a cascade effect or sort of a train-the-trainer effect. We don't just want to train them to communicate AMR, we want them to be able to train others too to communicate AMR effectively, which is why we encourage our champions to reflect during the breakout sessions. Aside that, we also encourage them to post their reflections on social media so that other friends of theirs can see it. And these are some of the reflections that they've posted. Just put a screenshot of that here for everyone to see. Next slide, please. Yeah, this is some of the reflections about what they've learned and how they want to utilize it during the WOW 2024. Next slide. So our focus for this year's WOW, which some of them have started already, is abattoirs, community pharmacists, primary health care centers, radio stations, social media, veterinary clinics. And we also made sure that we are not restricting our champions. Like I said, we want the youth to be innovative. We've trained about 40 youths currently, and we want them to be innovative, to use different ways to talk about AMR to their selected audience, which is why we allow them to use other target audience. For example, some have chosen to go to marketplaces, some have chosen to go to religious institutions, churches, mosques, some have chosen to go to public institutions and several other target audience to communicate AMR. So we are trying to be as big as possible to not limit their innovations. Next slide, please. So that's a wrap of the phase 1. And now we are working towards starting the phase 2, which we are happy to be funded by the Trinity Challenge. Now, the phase 2 of our projects still relates with helping champions to communicate AMR, but we have a strict target for this, and that is secondary schools across Nigeria. Next slide. So we intend to focus on 80 secondary schools across Nigeria to improve their WASH and AMR knowledge, so that we can have improved WASH practices to prevent and control antimicrobial resistance. We intend to use 2 major routes, that is, educate them using campaign messages that are key towards getting them involved in the fight against AMR. We want the secondary school students, which are aged between 9 to 15, to understand that they have something they can do to prevent antimicrobial resistance, that they understand the impact of that on their community and their friends, and they are willing to do something towards that, which is why we are using messages like wash to protect, sanitation first, antibiotic last, clean and save lives, and other similar campaign messages. We also want this process to be iterative. We want it to be participatory, which is why you see the arrow that joins the educate and the campaign messages. It's 2-way, right? That means that our champions are going to be getting data from the secondary schools to identify what are the education gaps over there, and they'll be using that to develop the risk communication messages they'll be passing along to those students. So it will be a way where the audience is involved in the message we develop to them. And then we are hoping to sustain this by providing WASH aids to the secondary schools, and also creating school clubs, WASH and AMR school clubs that will continue to educate about AMR. And we'll be using the train-the-trainer approach to train the champions. The champions will utilize the same method to train the secondary school students so that they can also pass on the training down to preschool students and other peers of theirs. So that's a wrap of our projects. Next slide. This is the team behind this idea. And next slide, please. And this funders and sponsors, the Microbiology Society South Center, funding the phase 1, OHDI being our patron and support for the entire project, and Trinity Challenge funding the phase 2. Next slide. That is the reference for the data I mentioned the other time, and I welcome questions. Thank you.
Thank you so much, Damilola. That was an amazing presentation, and really loved hearing about the school clubs and the sort of innovative ways to develop new communications. I like the sanitization first, antibiotics last. And so yeah, we'll go to questions at the end. So do please put any questions in the Q&A or the chat. And then finally, we're going to move on to a presentation from Juliet Allibone, who's the Public and Patient Engagement Lead and Head of Operations for the NIHR Health Protection Research Unit and Healthcare Associated Infections and AMR.
Hello, I'm Juliet Allibone from the Health Protection Research Unit in HCAI and AMR at Imperial College, and I'm delighted this morning to have been given the opportunity to talk to you a little about some of the educational initiatives which we have developed. As an NIHR funded unit, we've got public engagement and involvement as part of our remit. And that means that over the last few years, we've developed a broad range and variety of educational games and tools. These aim to answer questions around what is AMR, how does it occur, what does it mean to me on a personal level, and what can I do about it as an individual. Our resources are used at community outreach events, which are run in the White City area, and they're delivered at least annually by our fantastic staff and students at events such as the Great Exhibition Road Festival. That's a free weekend of science and arts which is held in London, and it routinely attracts around 50,000 attendees over the 2 days. We also make digital downloadable versions of our resources so that other people can access and run them. That means that the Snakes and Ladders game pictured here has gone out to 1,400 other local families as part of community engagement science packs, and that all the other resources that you can see here have been written up with detailed instructions and printable material for other people to run at their own events. In addition to these PPIE activities, we've developed 3 relevant lesson plans and accompanying resources for Key Stages 1 and 2, with links to other relevant materials such as the excellent UKHSA eBug. We map where the lesson links to the national curriculum, but as I'm sure we'll discuss later, AMR doesn't actually feature explicitly. So the links are largely to personal hygiene for Key Stage 1 and living things and evolution in Key Stage 2. As you can see, we promote our resources through a range of methods, and these include a direct mail out to all of our local primary schools for World Antibiotic Awareness Week and British Science Week. Our hand hygiene lesson is by far the most popular, and that's been delivered by our staff and by teachers to a number of schools in West London. We know that some schools delivered the lesson plan to every class and every year group during the pandemic, and the lesson plan has also been delivered by members of our unit at events run by their places of worship. Build a Bacterium lesson plan has been delivered to over 300 pupils and is a central activity in our ACE project, which is our latest endeavour, which I'll speak about next. So ACE is a citizen science project and is something I've been hoping to do for a while. As a parent myself, I've done the big butterfly count with my daughter, and I really wanted to try and find a way to generate the same enthusiasm and engagement around AMR, specifically targeting children. And I think that's important because, as with the environmental agenda, they are the inheritors of this next global challenge, but they're also the healthcare workers of the future and the parents of the future. And I think that often if you can engage them on a topic, they then become the educators of their parents. The project that we devised in the end was targeted at Year 6 pupils, so that's ages 10 and 11 and above, and it hopes to activate these school children to gather data from their trusted adults on antibiotic access and disposal. So to make the project work, we developed a project booklet, which you can see here, and using age-appropriate language and an attractive cartoon format, we explained what the project was. We also used the EpiCollect app to develop an online survey, which includes a facility to upload a photograph of any out-of-date antibiotics that people might have at home. There's a paper version of the survey for those without access to a device or without technical know-how. And most importantly of all, as we'll hear later, we developed a project badge to be given to every participating pupil. So a week before the project starts, a letter went home to all parents explaining what the project was trying to achieve and what they could do to help. So that was giving their children access to devices, helping them download EpiCollect, answering survey questions, and suggesting other people who their children might safely approach. There was also an opt-out for parents who didn't want their children to participate. Given the profile of the school, we provided the letters in both English and Bengali. Next came the hard bit, which was delivering the project material to 3 classes of 30 pupils, and I've got a photograph there of the brave team that went and did that. And the presentation itself included a demonstration of what AMR is and how it occurs, using our Builder Bacterium lesson plan. It covered what citizen science is, what the project was and aimed to do, and then age-appropriate instructions on scientific conduct. So that covered things like researcher safety, research design and the fact that they should only approach people over the age of 16 and only approach them once. It covered the importance of accuracy and not falsifying data, and then ethical things around consent and confidentiality. That was then followed by 2 weeks of data collection, and I have to say that was massively facilitated by the school, who were fantastic and encouraged data collection from school staff and from other parents doing drop-off and pick-up. And they also introduced an element of interclass rivalry, which I'm sure really helped. We also promised that if they generated enough data, we would go back to present the findings of what they had generated. So in terms of the results of the pilot, I think given our aim was to engage young people with AMR, we can clearly see from these pupil quotes that we really succeeded in that. We also generated 192 responses from this one school, which probably means that every child in those classes completed at least one survey. Of those, 190 were on paper, which rather surprised us, but that's perhaps indicative of the fact that they didn't have personal devices, and as Year 6s, they certainly wouldn't have been allowed to bring them into school. Project feedback from those involved has also been really positive. You can see a quote there from the highly engaged Head of Science, Jennifer Gill, who mentioned the importance of the badges, but also how the project had empowered the pupils, how they were really keen on having extra surveys and were spending their lunch times collecting the data, and how the project offered a real chance for scientific learning outside the classroom. Our fantastic population health and policy research lead, who helped deliver the project, is also really positive. And whilst she's busy analysing the data, there's no doubt that this project has the real potential to generate quite a lot of information as it's rolled out across other schools. So our next step, we have a pilot planned, this time with a secondary school, which will run during World Antibiotic Awareness Week. And so we look forward to the data on that, most of which I suspect will be via the app. We've written out to all schools locally promoting the ACE project for World Antibiotic Awareness Week, so we'll see if we have any take up there. And finally, we hope to use the project at the Great Exhibition Road Festival next year in the hope of not only generating citizen scientists who will collect data at the festival, but more than that, citizen scientists who will then take the ACE project home with them and hopefully run it at their schools and in their communities. And so that's it from me. Thank you very much.
Thank you so much, Juliet. That is amazing to see the whole process, and really nice to see how young people and the children felt empowered to be researchers themselves. I'm just going to stop sharing for a second and see if we've got any questions. And if not, I've definitely got one for everybody. So I'm going to start. So, I mean, if Donna, Damilola and Juliet, I just want to ask sort of each of you, if you could tell one thing to sort of people in the audience who are feeling inspired to go and do a AMR initiative with kids or young people themselves, what's the one thing that you'd like to sort of tell them based on your knowledge and experience of delivering what you've delivered so far? Donna, do you want to go first?
The one thing that I would say is be prepared is my honest response to that. Children and young people are unbelievably honest, really frank. they're, especially the younger ages, there's no filter there. And I know when we were developing the eBug resources and we were developing some of the artwork for the resources, we trialed everything with the children and young people through the schools. And, you know, we got some feedback on some of the characters that we were developing, which was things like, oh no, I don't like her. She thinks she's cool, but she's not. And you're going, well, what does that mean? And then when you sort of delved a little bit deeper into what these young people, these 7-year-olds meant by that, it was really about how the characters were dressed and the fact that she looked as if she was smirking in the artwork and things. So it's incredibly rewarding, but have a thick skin, because there is a lot of honesty there. But every bit of feedback only goes to make a better intervention that the young people are more comfortable using. So do involve them, but be prepared.
That sounds like excellent advice and something I can imagine being very true as well. Thank you, Donna. Juliet, over to you.
Yeah, just to echo what Donna has said about involving them. It's very easy, I think, to develop a resource in isolation, but actually without the engagement of the school, that's not going to achieve anything. So we were extremely lucky to be working with the primary school we were working with, and certainly the engagement of that science lead, I think, made all the difference in terms of the data collection, and making sure with that longer run that the children were reminded and remained engaged. So yeah, I think that's a really top tip for anybody who wants to try and do this.
Amazing, thank you. All extremely valuable advice that I'm sure we'll all be taking on board. Damilola, over to you.
Great advice. I think I can relate a bit with some of the things that have been said. So what I just want to add is that it's also be nice to encourage the target audience, that children of 9 downwards, or persons of 9 to 15 or other youth, to also speak about AMR. And the thing is that once they are excited about things, children and youth can go on and on about it. So we want to try and encourage them not just to learn, to get the knowledge, but to also teach other people. So trying to integrate the train-the-trainer approach into the education initiative will be really good, so that they can also be advocates of AMR all the time. Yeah.
Thank you, Damilola. I'm just going to hand over to Kerry, one of the co-hosts, who I think has got some questions for.
We do. We've actually just got one that's come through in the chat. Are there any plans to include AMR in the national curriculum at primary school level? The amount of times I hear about climate change and pollution from my 8-year-old, I can already see the impacts and how engaged she is on the topic. And thanks. Not sure if this panel. Yeah, don't know.
I can touch on that. We have looked at the national curriculum, and you're right, in the primary school ages, AMR isn't really in the national curriculum. There's a lot of work in the national curriculum about infection prevention control. So lots of things there about hand hygiene, respiratory hygiene, but AMR isn't really mentioned. So the UK national curriculum, or certain elements, the RSHE curriculum, for example, is out for review at the minute. And we did speak to the people who were looking at that, and we've advised them and asked them to include AMR in that. So it's out for consultation. So we have to wait and see. And my understanding is, I think the entire national curriculum, somebody else might be able to correct me on this if I'm wrong, but I think the other elements of the national curriculum are up for review over the next few years. So all we can do is lobby to get AMR included. But it is included in the senior national curriculum, but it's very much focused on a hard science perspective rather than a public health perspective. So I'm really interested to hear about the climate change in the second session, to see how you were able to influence that and how that was able to be taken forward in the curriculum. I don't know if that answered your question or not.
I think that was great. Thanks, Donna. Damilola, you've got your hand up.
Yeah, I just want to add that over here, we're also considering doing the same thing, because recently Nigeria launched the National Action Plan for AMR 2.0. And a key part of it is including AMR in national curriculums. And we are looking towards utilizing the data we've gotten to identify key gaps when it comes to AMR education in secondary schools. So we can now use those data, present it to national stakeholders, and hopefully that can inform their process of including AMR into curriculums.
Can I also just add in there as well, linking into what Damilola was saying, you just reminded me. It is important that IPC and AMR do go hand in hand. It is important to teach about IPC as well as teaching about AMR as well. And just sort of to correct what I said earlier on, when I say national curriculum, I keep saying UK, I mean English national curriculum, not the entire UK national curriculum, sorry.
Okay, we've got another question for the panelists. Thanks so much for your presentations. What are the financial implications of developing a national curriculum, and what are the policy challenges? Maybe we'll keep going with some other questions if the panelists don't have hands up for the moment. Another question that's come in, how do you measure or monitor the impact of your outreach or education activities? What are your KPIs on those? Damilola.
Okay, for the initiative we have, part of our KPI is to know the amount of youth that have been trained about the best ways to communicate AMR. Then we also want to know the amount of persons they have been able to train using the train-to-trainer approach. That's a key part of it. The other thing we want to do is that we have a pre-survey, a pre-training survey and a post-training survey to see how well their communication skills have developed over the time after the training itself. And so the reflection sessions allows us to see how our training module or how our training system is, how good it is, and we can use that to refine it over and over again. So those are some of the KPIs that we have. I'm also looking towards getting data from the champions about how many audiences they were able to reach, and then follow up on the audiences over time. How has their attitude changed from the knowledge that they gained? And we'll be doing that more frequently in the phase 2, where we'll be interacting with the schools that we're targeting for 5 months to see how well the attitude towards WASH changes from the beginning of the advocacy or the campaign towards the end of the campaign too. Thank you. I hope that answers it.
Donna, go ahead.
And I think I can add to that. I know when we develop our eBug resources, we evaluate various stages of the process as well. So the first thing is looking at feasibility and acceptability. When we develop a resource, is it acceptable to the teachers? Is it acceptable to the students? Is it feasible for them to implement it as part of the national curriculum? We've evaluated knowledge, so looking at before and after knowledge, and that knowledge retention as well over time. So from the children and young people, have they learned something and have they retained it? But also the qualitative elements are just as important as the knowledge, because if knowledge hasn't been improved, why? Is it because they didn't engage with the activity, they didn't like the activity, etc.? Looking at confidence is really important from a teacher point of view, looking at their confidence in implementing the activities. And we also survey on a semi-regular basis. I say semi-regular because it's every few years. We'll survey the teachers to find out, are you using eBug? What parts are you using? What do you like? What do you not like, etc. So we do these regular surveys as well. And then for us, weblog data is really important. We monitor usage. Where are users going? What parts are they going to? Why are they, trying to look into why they're going to where they're going, to look at end user. And we've also looked a little bit at behavior. We had started running a study. I'm smiling because everybody is going to relate to this. We started running this study and COVID put an end to it very quickly when schools closed. But we were looking at things like, for infection prevention control, we were looking at things like tissue use in the classroom, use of hand washing and things like that. So we were looking to see if there was a change in behavior, looking at the volume of soap that was used, etc. During the study, and we were starting to see some positive results, but then the study ended, so we can't really say anything for certain in that. But there is a lot that you can look at an impact, and I think it's important to look at everything as a whole rather than just focus on just one section. I think exactly as Damilola said, you look at a lot. You don't just look at his knowledge improvement, because does that knowledge link to attitude and behavior change? And that's really, really important.
Thank you, Donna. Kerry, do we have any more questions?
We do. We've got a question about the role of teachers in all of this. Have the panelists linked, with national education leaders in their respective countries? And, do you have teacher ambassadors, or, should we be involving them as our training leaders? What is the role of teachers?
Damilola, do you want to go first?
Yeah, so the phase 2 of our project requires that we start AMR clubs, and that is to ensure sustainability of the knowledge that we will gain. So what the AMR clubs will do is that at routine morning calls or roll calls, they are going to, students in those clubs are going to be talking about WASH and AMR every week, directly to the entire student populace. So to ensure that this is well accepted by the schools, we have made it that teachers are going to be patrons of those clubs. So they'll sort of be the supporters of the club, getting it established in their school and ensuring that it continues to run over and over again. And we're also handing over the WASH aids that we'll be providing towards the teachers, and we'll also be getting feedback from them with regards to the attitude and change of practices directly relating to the students, and also what the students' parents think about what we are doing, because we also want them to sort of encourage that, not just in schools alone, but also at home, so that practices can be sustained over time. So that's what we are doing to engage teachers in the entire thing. But yes, they are very, very vital when it comes to education initiative. They can ensure the success of that, especially when you're introducing into the new environment. Yes, they are key stakeholders.
Brilliant. Thank you, Damilola. Juliet.
Yeah, just to echo all of that, I mean, the teachers are absolutely key. In a lot of ways, they're the kind of gateway for the resource being delivered and delivered successfully within their school. And for us, with our little pilot, the teacher was key. So we'd been invited to do present our hand hygiene a year ago. And then they invited us back the second year because the pupils had loved it so much. And that was what then enabled us to make contact with the science leader, then pilot ACE. So it's been absolutely fundamental to enabling us to pilot these things.
And I think I'll add to that as well. Completely agree and echo with everything that Juliet and Damilola has said. But to add to that as well, it's the majority of us are public health experts, right? And we know the message that we want to get across, but teachers know how they teach. And teachers know how children will listen to those messages, how they'll respond to the messages. So it is crucial to bring in teachers at every single aspect of this to get their input, to get their insights, and to tell us what they need. There's no point in spending time and energy and resource reinventing the wheel if there's already some really good resources out there. Let's promote what's good and spend energies looking at what else needs to be done and needs to be developed from the end user, which is the teacher perspective as well. But also ministries of education are really important. It really is important to engage with the ministries of education. One of our partner countries, France, really had concrete linkages with the Ministry of Education from day one, and eBug is really embedded in the majority of schools across France. In England, we work closely with our Department for Education as well, and they promote resources as and when they're able to. But there are different rules in different countries about that engagement and what can be done. So it's not just teachers, but also your ministries of education are important as well.
Thank you so much, Donna. I think we've got time for one more question. So I think Kerry's got one lined up for us.
I do, thank you. So we've heard a little bit about informal education outside of schools. Are there any other contexts that we should be thinking about besides schools?
I would say yes, 100%. I think you should be, or healthcare professionals, it's something that it's going to be covered a little bit later, but I think schools are one avenue of education. You've also got communities, you've got parents, you've got healthcare. There's so many different ways that young people can receive information, and we should be providing that consistent wraparound messaging to children and young people across the board. So I do think the healthcare profession is another area where we should have that joined up key messaging. So that wherever a young person goes, a child or a young person goes, whether it's to their doctor, whether it's their school nurse, whether it's their teachers, they're getting that same consistent, messaging around infection prevention control, but also about when and how to use antibiotics.
Thank you, Donna. Damilola.
Yeah, just to add to what Donna has said, which is quite true, is that we also over here in Nigeria, a lot of persons do attend religious institutions. So we're also looking at targeting that. Some of our champions are already engaging with the associations to ensure that the message gets to youth and children in those places. So of course, it is very good to target other areas, like Donna said, so that we can all get the information. They can get information from both sides, and that can encourage faster uptake or quick uptake of what we're trying to get them to do or try to get them to understand, and they can change their behavior and improve how the practice IPC. Yeah, thank you.
Thank you so much. Great. So we're going to go on to the next speaker. I'm just going to reshare my screen. And so I'm really excited to have Jennie Smith from the Trinity Challenge to talk to us about their plans for youth engagement in AMR in the future. So Jennie is the Communications and Events Manager at the Trinity Challenge, working on global health with a focus on youth engagement. So over to you, Jennie.
Thanks so much, Kate. Just making sure that you can see and hear me. All right.
Yeah, all good.
Okay, brilliant. Thanks. Hi, everybody, and thanks for having me. And thanks to the previous speakers. It's really great to see such a sort of variety of speakers and different perspectives on this really important topic area. So if we go to the next slide. First of all, I just want to give you a brief introduction to who the Trinity Challenge is. So we're a charity organisation based out of Cambridge, and our leader is Dame Sally Davies. She's the chair and founder of the Trinity Challenge, and I'm sure many of you will know her as a leading voice within the AMR space. She's the UK Special Envoy for AMR, and previously held the position of Chief Medical Officer for England, the first female Chief Medical Officer, which is very exciting. So our vision is around data and analytics, and them holding the key to building effective, affordable and scalable solutions to current and future pandemics and health emergencies. We realized that during the COVID pandemic that there wasn't necessarily that much data, especially in low and middle income countries, that could support an approach to dealing with that kind of pandemic. So that's one of the focuses that we have. And then our mission is really looking at data-driven tools and technology and creating really innovative solutions with people from around the world. So we've done 2 challenges now. The first that was focused on pandemics, and the second that was focused on AMR, where we've had £1 million prize funds that we've given away to teams across the world. So if we move to the next slide. So why it's important for young people to know more about AMR, and also for them to feel empowered in leading this change in global health. Obviously, it's a global health threat. It's affecting everybody. It's a way of understanding more about your personal health and how better to protect yourself against these global health threats. The main reason is that we recognise that this isn't just a challenge for now, it's a growing challenge for the future and future generations. And so supporting young people and arming them with the information that they need to deliver successful campaigns and mitigate AMR is really important. Obviously, young people have expertise in so many different topic areas, and so they're always willing to look at the One Health approach and take on board the different aspects that are necessary in mitigating AMR. As we know, in so many different areas, young people are innovative, they're creative, they bring fresh and interesting ideas to topic areas such as AMR, and so encouraging that is incredibly important. And then obviously it's part of the Sustainable Development Goals as well. If we could move to the next slide, Kate. So what did we want to achieve by holding a youth summit? So we held a youth summit in 2024 in the summer. And the main purpose of that was we wanted to bring together change makers and youth leaders and activists in the AMR space together so that they could understand what the priorities were in different areas. They could work together, they could share ideas and knowledge. And then what we really wanted to encourage was like co-creation and co-design. So rather than us as the Trinity Challenge, telling young people what their priorities should be or what their focus should be. It was them telling us. We also wanted to provide sort of tools and insights and briefings by engaging different experts and bringing different voices from around the globe to the table. And then one of the really key important things that we tried to do was engage a diverse set of participants. So bring in people who are not necessarily always at the table to the table to really sort of discuss and drive that change. And then encourage sort of a global network of a new generation of AMR activists was one of our big priorities, which is still an ongoing priority for us. If we could go to the next slide, please, Kate. So this is just a little GIF if you can play it. It just gives an overview of what we achieved there. So over 2 days, we ran 3 separate events. We had over 100 young people from different organizations representing 7 regions around the world. So we had really good sort of geographical global engagement. And then during those events, so on day 1, they looked at a whole host of different campaigns. And then at the end of day 1, they voted what they would like to take forward to day 2. And then on day 2, they went into a bit more detail on what a campaign might look like, what might be successful, what kind of key messages really work well and land well, especially with young people. And then they voted for the final, their final option of the campaign, which was washing schools, which obviously is a really important preventative method in AMR. If we could go to the next slide, please, Kate. So following the Youth Summit, we launched a competition, which was a seed funding competition. There were 7 pots available, 1 for each of the regions. Globally, we aligned with the World Bank region definitions. And so total funding awarded was over £51,000. And we really tried our best to get as good a global spread as we possibly could. We wanted different places to deliver what worked well for them and have something that was tailored to their needs in their area. If we can go to the next slide, please. So we had a really fantastic competition response. We had 97 applications, and that was representing 46 different countries of activity. 6 of the regions were represented. And then from that, our panel of expert judges whittled it down to 7 teams, and they were selected to win the seed funding to deliver their campaign on antibiotic resistance with a focus on washing schools. So really successful, and that has led to us being able to fund these 7 campaigns. So if we move to the next slide. So these are the different projects that we'll be funding. We've got one in India. We've got 2 teams that are working together in Ecuador and Guatemala. We've got one in Nepal, one in Kazakhstan, one in Nigeria, which you might recognize that team name because one of the team lead from that has been speaking today, Damilola, really fantastic. And then one in Uganda. And the teams are all very different. They're all taking a different approach and bringing a different perspective. They're all working with young people. Some of them, like Bridging Traditions in India, are looking at sort of like Eastern and Western medicine and how the different approaches can come together to really deliver well on AMR. We've got some who are taking an artistic approach and trying to incorporate art into the and creativity into the projects. We've got teams like Damilola's who are working with sort of train the trainer approach and creating AMR clubs. So lots of different approaches, but all really fantastic and successful. There was a very high standard within the applications. It was very difficult for our judges. If we can move to the next slide, please. So following the competition, we decided that we need to learn more about what young people need. And so we have launched a youth survey. So if you're a young person or a youth organization working in the AMR space, we'd really love you to complete the survey. I think Kate might have dropped it in the chat already. We just want to understand more about what the challenges are, what the barriers are to you entering into this space, and what support you might possibly need in order to deliver projects, campaigns in your area that are successful. So please consider sharing that link with people that you know or completing the survey yourself. On to the next slide, please, Kate. So what's coming next for us? Because of the success of the first youth summit and youth competition, we've decided to launch a second youth summit and competition. We will be doing 2 sessions on Tuesday, the 14th of January in 2025, and they will be the same session run twice. It's just so that we get a good sort of time zone spread and global spread as we can. So you don't need to attend both. You can if you want, if you're very keen, but you can just attend one of them. Following the summit, we'll be launching another competition for seed funding and really encourage you to start thinking about what you might want to enter into that competition. And the theme of that is how we can ensure appropriate use of antibiotics in the food chain. So because the last one was voted to be washing schools, obviously it had sort of like a human health focus. So this time we wanted to try and encourage people who are working in like environment or animal health to apply for the role, apply for the competition. So have a look and think about that. Thanks, Kate. And then just a reminder to sort of follow us on social media and to follow, you can also sign up to our newsletter online, and that will give you first-hand information on what's coming next and when you can sign up. The registrations for the summit are in the chat as well. Thanks, Kate.
Thank you so much, Jenny. That's fantastic, and I'm so excited to see what all those different those winners do, and maybe we can have them featured in the webinar next year as well.
Definitely.
All of those surveys and sign-ups are in the chat now. In the interest of time, we're going to move on to the next speaker, but please do drop any questions for Jenny into the Q&A and she can answer them for you there. So just for the last bit of this first little section, we're going to go back to Donna Lecky from the UKHSA to discuss some of their UK population data and think about, why are we doing this? Why are we having this conversation? And what is the rationale for it? So back over to you, Donna.
Okay, thanks, Kate. So I've been working on eBug and with children and young people for a very long time. And one of the questions I often get asked is, why should we focus on educating children and young people about AMR, especially if parents make the ultimate decision about their medication? And I think the answer, Damilola definitely touched on it earlier, is fairly simple. By targeting the young population, we are not only able to improve their health and well-being, but can ultimately reduce the spread of infection in families and community. Also, children are the proven agents of change within their communities. They amplify messages across communities. Anybody here who is a parent, has a younger sibling, has a niece and nephew, will at some stage have heard their sibling, their niece or nephew, or their child come home really shouting loudly about what they learned that day. So they really can amplify these messages. And we can ensure that the antibiotic users and prescribers, it doesn't take long for these children to grow up, that these users and prescribers of tomorrow are well equipped and informed. But what about those young people? What do they know? Well, UK Health Security Agency, move on. And next slide, sorry, Kate. UK Health Security Agency, we run public surveys every year since 2019 and every 4 years before that, looking at public knowledge, experience and health-seeking behaviours around antibiotics and antibiotic use. Previous slide, sorry, Kate. And in 2022, we ran this survey with a focus on the wider determinants of health. And one of the first questions we asked is, to the best of your knowledge, what do you think an antibiotic is used to treat? And 3/4 of the public selected that antibiotics are used to treat bacterial infections, which is quite high, but that is still 1/4 of the public that didn't know that antibiotics are used to treat bacterial infections. But compared to the total, understanding was statistically lower for the following groups. And you can see that 18 to 34-year-olds gave the lowest correct response here. Compared to the total population, a significantly higher proportion of 16 to 18-year-olds also felt that antibiotics could be used to treat colds and flus, pain, headaches, and allergic reaction. Next slide, please. We did go into more depth about what antibiotics can treat, and here you see that 29% of the total population reported that antibiotics could be used to treat the majority of colds and flus. And 29% and 20% of the total population reported that antibiotics could be used to treat COVID. For both of these questions, the younger adults were more likely to give the incorrect response. And these findings are in line with Eurobarometer findings, which suggest that younger adults may be less knowledgeable about antibiotics use, but they're also more likely to change their mind if given the correct information. So there is an opportunity here to educate our young people and change this knowledge. Next slide, please. To examine attitudes towards antibiotics, we asked participants to answer true or false to a series of statements. And what you can see here in this top box is that compared to the total, 18 to 34-year-olds seem to be less confident in their GP decisions compared to the other age groups, less confident in their GP decisions not to prescribe antibiotics, and less pleased about it, and less likely to wait and see how their illness develops. In the middle section, you can see they're also more likely to take antibiotics just in case, and more likely to take, and they also feel that antibiotics always speed up the recovery no matter what the infection is. So they're more likely to think that than their other age counterparts. And young people at the bottom here, you see they're also less optimistic that there's something they or society can do about antimicrobial resistance. Next slide, please. What you can see here is we asked about frequency of antibiotic use. And you can see in this top row that a higher proportion of the younger population did not take any antibiotics, or less, sorry, a lower proportion of the younger population did not take antibiotics, so 22%, but a higher proportion were more likely to take 2 or more courses of antibiotics in the previous 12 months. Next slide, please. When we asked about where they obtain antibiotic, the good news is that the majority of the population, 92%, obtained antibiotics from a healthcare professional. But when we did dig a bit deeper into alternative means, we found that the 18 to 34-year-olds were also significantly more likely to use leftover antibiotics, so antibiotics that they had not finished the course of or that were left over in their homes compared to the total, and they were also more likely to obtain antibiotics abroad compared to the total, as were these other demographic or these other groups as well. So next slide, please. So in summary, younger individuals appear to be less knowledgeable about antibiotics, appear to be more impatient when they get ill, they're more likely to take antibiotics, and they show increased levels of usage and frequency. So really education is required on how and when to use antibiotics. And I think last slide, please. So how do we educate children and young people? And this was touched upon before. School seems to be the obvious avenue, but we do need to provide that wraparound support and education by looking at parents, looking at the community. And this could be like after school clubs, it could be Scouts and Girl Guides or other youth clubs, etc. And also the healthcare setting. There is a lot of evidence out there that if you educate an individual on why they may not need antibiotics or don't give them an antibiotic when it's not needed, you can reduce reconsultation rates there as well. So it is about providing that wraparound care. Last slide, please. And I think this is just to thank everyone who was involved in this work. I've had the privilege of presenting it, but there was lots of people involved. Thank you.
Thank you so much, Donna, for that. And yeah, any questions for Donna, please put them in the chat. And so I'm going to stop sharing now. And I'm really excited to move on to the last bit of our webinar this morning, which is our panel. And we're going to sort of discuss the challenges and benefits of building AMR into our curriculums across the world. So please do put any questions into the Q&A, and any we have time for, we will try to do our best to get through. But let me please introduce our 3 panelists. So we have Cleo Heslop, who leads the British Science Association's policy and stakeholder engagement team, working to influence organisations from policy, business, civil society, media, research and education sectors. Cleo manages various BSA policy programmes, including work on education, public attitudes, youth voice, diversity, inclusion in STEM and community participation. So thank you for being here with us this morning. Mimi Mellers-Brewer from the World Health Organization is also with us this morning and is a public health expert and medical anthropologist with over 15 years of experience in qualitative research, community health initiatives and global health partnerships. She currently serves as a technical officer at the WHO in the AMR division and supports global awareness and educational initiatives on AMR. And finally, we have Louise Robertson, who is an innovative educational leader with over 35 years of experience in international education, sustainable curriculum development, and public speaking. As the founder of the Sustainables Academy, she spearheads the creation of globally aligned resources for sustainability, the circular economy, and climate mental health, empowering educators and learners to embrace Earth stewardship. So thank you all for joining us this morning. I'm going to start with a question to all of you, and you've all got various different backgrounds, but it would be amazing to hear your thoughts on this. So is it important to embed, how important do you think it is to embed AMR and other sort of similar public health topics into curriculum so that we can, you know, in the case of AMR, create antimicrobial stewards of the future, but, you know, in sort of with links to climate change as well. So I'm going to go to Mimi first for that one.
Thanks, Kate, and hi, everyone. And yeah, I just want to thank everyone for joining this excellent webinar, and special thanks to Fleming Initiative and CAMO-Net for hosting. So I would say the answer is yes, it's very important, and there are a few key reasons. One is building awareness and knowledge at an early age is key. So introducing AMR concepts at all levels ensures that individuals understand the issues early and can adopt appropriate behaviors like responsible antimicrobial use. And understanding AMR should go beyond the science of infection and its negative effects and be balanced with, you know, the importance of hygiene and the role of bacteria. We also need to embed AMR into the curricula to normalize discussions about health and well-being. So talking about seeking advice from a healthcare professional or tackling the misconceptions about antibiotics being used to fight against viral infections. And also, of course, 3 is that youth play a critical role now and in the future. So in certain contexts, young people are the ones sent to the pharmacy to buy medicines. They also need to understand what antibiotics do so that they can help their parents or peers make the right choices. So this young generation will also be the future prescribers of antimicrobials. And One Health education will help foster intersectoral collaboration, which is necessary to tackle AMR. So I would say that creating antimicrobial stewards of the future is not only about knowledge, but fostering a sense of responsibility and empowerment. And we need to ensure that the educational system is equipped to empower this generation and future ones to be prepared to lead, innovate, and advocate for a sustainable response to AMR, especially as healthcare systems continue to evolve. And as mentioned before, it's a really strong achievement that the important role of young people and the education sector was recognized in the final political declaration of the UNGA. So now we just need to take this forward to action and scale up. Thanks.
Exactly. Thank you so much, Mimi. Cleo, over to you.
Yeah, I'm not sure how much I can add to that, actually, Mimi. That's absolutely fantastic. Yes, I think it's really, really important, and for all of those reasons that Mimi just mentioned. But I think the things that I would like to kind of add or build on is that I think it's really important to take that kind of cross-curricular approach, and for it not just to be within science and health related learning, but to find various touch points across many different subjects so that you get that normalization, that relevance, and also that kind of equity that all young people feel like it is something that they feel comfortable and confident with. So, you know, we know from our work that there's a lot of young people that from quite an early age would say that science isn't for them, or they don't feel good at science. So with topics like this, it's so important that they encounter it across many different subjects and lessons, so that they feel like it's something that they build confidence in, and that they have the knowledge and skills to work on. And then the only thing I'd add to that is again that kind of you spoke a little bit about it, maybe feeling supported and empowered to use that knowledge in daily life. So I'm sure we'll come on to talk more about this, but I think being solution oriented, you know, young people tell us a lot that they learn a lot about causes and problems, but they don't feel like they learn enough about what they can do about it. So I think that's really key, as well as that kind of cross-curricular approach. But it really is so important, as from that data that we've just seen, And from our own understanding from work that the British Science Association has done, that the earlier you can start, the better, because by the time young people get to 18, they sort of feel like they've chosen their future path, they know where they're going, they know whether they're going to continue looking at science subjects or not. And so really that kind of early breadth is so important.
Thank you, Cleo. It's great to think about that having that focus on solutions is sort of like the motivator for how we do things. And Louise, over to you.
Hello, thank you very much for inviting me, and thank you for everybody that shared this morning, because it was great learning for me. There were some wonderful things going on. To answer your question, I think it's about ownership and relating to Earth stewardship, and understanding that we have this one world and we have just the resources that we have within our biosphere, and that we need to work together to ensure that they remain infinite rather than finite. And I think that's a key. We also need to realise that our young people are really empowered, and in actual fact that they design their own learning, that they like to take big questions and answer those big questions. I know that a teacher likes to have a little lesson plan to support the direction of their learning, but when you can actually draw from your young people from the age of 3 to 18, they have wonderful ideas, they know more than we realise that they know, and building upon that prior knowledge is really, really important. And I think that some of these things, particularly with this topic, that we do, if we're looking at all the curricula across the globe, we got a little bit Anglo-centric, I felt at one point, but we need to look at all the different curriculum models that there are globally. And we found that developing pathways that can be looked at if you're studying in the national grade science subjects in the USA, whether you're in Australia, New Zealand, or here in the UK with our 4 nations, that you can build upon the curriculum that you have. And I think that it is so important for that. We've mentioned interdisciplinary learning, and having interdisciplinary learning to access these topics is really, really important.
Amazing, thank you. And Louise, just to stay with you for the next question, you know, we've heard a lot about AMR initiatives, but I think climate change has really paved the way for, you know, building education into curricula. And what lessons can we learn from you and people in climate change and the Sustainables Academy to think about the best ways to really get a presence on educational curricula?
I think we've got to stop thinking in silos, and climate is just one of the strands in Earth stewardship. We have to look at our biodiversity, our global health, whether it's mental or physical, and our Earth health. And if we don't have those aligned, we really have a big problem, and we're going down the track of a big problem. I liked when the Trinity project shared about the arts. I do think that if we go into a silo of STEAM rather than STEM, we're not going to get that interdisciplinary learning, critical thinking, interconnectedness, reaching out to real world examples, and just being able to empower our young people. I think that those have been the main issues, and understanding that I think one of the issues has been to do with climate, mental health, and anxiety. That we have big flag up panic moments, and everybody's up in arms rather than taking a really steady, holistic view and looking at that responsibility. And that's what we've actually got a model for this topic within our curriculum, and understanding our soil health. And you know, one of the 3 aspects of air, land, and water, those are the 3 aspects of our biosphere. And our soil health affects our food systems, our health in general. We look at our resources that we're extracting, the way that we use all our resources to extract our resources and the impact that that has on our environment. And so it's not looking at silos, it's looking at cross-curricular, interdisciplinary learning and interconnectedness. Thank you. I mean, there's so much we can learn from what you've achieved so far. Cleo, over to thinking about, you know, you've got this incredible knowledge of the science curricula in England. How can we advocate for change? You know, if we're doing our little projects and silos, how can we advocate for change and the broader inclusion of AMR into the curriculum? And also, how can, you know, organisations like BSA help us do this?
Yeah, that's a good question, and yeah, I'm sorry that I am so UK and particularly at the moment England specific, and I think, you know, down the line it would be great to see much more connectedness. But I think what I'm going to say is fairly pragmatic, I'm afraid, and that is in the case of science, definitely, and in other subjects as well. There's generally a feeling that the UK curriculum is too full. There is too much in there for teachers to get through with the time and resources that they have. So I think that is when we're thinking about advocacy and finding the place for specific inclusion of AMR in the curriculum, we've always got to have that in the back of our mind, is that either we've got to find something that we can take out, or we've got to really kind of find clever ways to thread it through and link it, and just show. And I think there are various climate change projects that have done a good job of this, to kind of track changes on the curriculum and say, with what's in there currently, these are all the places where you could make much more explicit references. So I think there is an opportunity here and now. There is a curriculum review happening across England. So that is work that has started with a call for evidence, which actually closes tomorrow, but I think will then over the next year or two be really looking much more in detail at different subjects. And I think for us at the BSA, AMR is an area like climate environment where we'd advocate for a much broader approach, and seeing it threaded across beyond STEM subjects and across the whole curricula. I think that the other thing that perhaps starts to get around the issue of too much content is the importance of project and practical work as a way to really kind of motivate, bring young people into the conversation, give them those tools and confidence to come up with their own ideas and solutions. And across this morning, we've seen many fantastic examples of that. I think the final thing to mention is assessment. So it's not just what's in the curriculum, it's then how you assess it. And that's another thing that's being looked at the moment. And I don't have a neat idea for how you then, what assessment on AMR curriculum would look like, but I think that's definitely something to be keeping in mind. It's like, you know, how would you start to evaluate that learning? And again, I think there's loads of great examples we've heard this morning of evaluation, and thinking more about what that would look like in a school context will be really important for getting it in there and really formalizing it across the UK.
Amazing, thank you so much. So much hope as well for the future in terms of the curriculum review and things. And Mimi, I know personally of some of the amazing work that you've done with the WHO and across different organisations, but I wanted to ask you, so what are the challenges that you found in that sharing of knowledge between global organisations or scaling education initiatives? And how is your work and the WHO's work trying to overcome those challenges?
Thanks, Kate. It's a great question. There's several key challenges. I think one is the inconsistency and the quality and the coverage of AMR education and training across countries. As you saw today, there's excellent material from civil society, academia, and government stakeholders. But these are all useful tools, and they should be adapted to different contexts. But there is that variability And that warrants, I think, a global evidence review, which can provide some standardization and allow for the local adaptation. The second is around the limited integration of AMR into curricula. You may have heard of the Tracking Antimicrobial Resistance Country Self-Assessment Survey, TRACS, it's a bit of a mouthful. That was the report from 2023 indicated that only 16 countries, 16% of countries reported that school-going children and youth receive education on AMR. So that in itself is a really significant gap that countries have not yet prioritized AMR, and there's a need to scale up. And the third, I think, is around resource constraints and the insufficient teacher training. So also in the TRACS report, only 28% of countries have costed and budgeted their national action plans on AMR, and only 11% have budgeted money. So most likely little or none of this funding is directed to the teacher materials, the training for educators, integration of AMR into existing curricula. So that's something we need to push for as we follow up from the high-level political declaration. Mentioned before also was the cultural and linguistic barriers. Education materials absolutely need to be culturally relevant. They need to be available in the local languages to ensure effective learning. And this requires additional time and expertise and funding. And then the other challenge I wanted to highlight was limited data. We have, particularly in low and middle income countries, limited capacity for data collection, limited baseline data on knowledge, attitudes, and behaviors regarding AMR. And WHO has just recently, we've been proposing AMR-related questions in existing survey tools, both at the school policy level and also for adolescents, so that this can help us measure progress, identify areas for improvement, but also make the data collection methods more user-friendly for countries by embedding AMR into the existing school health and well-being surveys. There's some other health educational initiatives that I thought would be worth mentioning today. In the formal education sector, we're working with the UNESCO International Bureau of Education, which has a specific mandate to develop standardized curricula that is holistic and integrated. And they are updating the curricula to encompass a wide range of health and well-being modules. And among the 62 modules, we'll cover hygiene, immunization, environmental health, and other AMR-related issues. And this approach really required a range of technical expertise, as you can imagine, within WHO. So we've been working across the different technical departments to support this initiative. Meanwhile, we're also getting a lot of requests from the WHO country offices as the ministries of education are revising the national curricula. So we're providing that kind of technical support at the national level. And then during WOW this week, we also released a Kahoot, which I know is a very popular educational tool. And that's targeting youth, of course. And we really want to utilize the digital platforms to help educators, because we believe that interactive kind of gaming functions make a significant difference in reach, where the curricula is not, the education is not available in the schools, and also make learning fun. Also, we support the quadripartite working group on youth engagement for AMR, which goes back to youth empowerment and really leading on different initiatives that the quadripartite supports. So we have a powerful platform of 14 youth-led and youth-serving organizations who are dedicated to AMR awareness raising, capacity building, and advocacy. And they just recently developed a storybook called Leslie Got Malaria, and that targets the 5 to 10 years, and it tells the story of a young girl who experiences drug-resistant malaria and wants to act. So we're quite excited to see this kind of innovative initiatives from young people and more storybooks in various languages over the coming years. And then finally, the 6 organizations. So we have the quadripartite, along with UNICEF and UNESCO. We'll be releasing a policy brief on AMR prevention and education, targeting policymakers and school practitioners. And the aim really is to increase awareness in the education sector and push a call to action to prevent and spread the AMR in schools. So we really believe that, these new partnerships, initiatives, whether through the formal or informal education, we can really help catalyze a global discourse, a movement to address some of these challenges that I mentioned. And we also really welcome thoughts and ideas from stakeholders on how WHO can, shape our contributions to this agenda.
Thank you, Mimi. It's exciting to think about all those partnerships and what they'll lead to in the future. I feel like this is a conversation we could have all day, but we are slightly close to time. So I think, Kerry, we've got one question from the audience. So if we'll just sort of we'll take one, sort of do a quick answer each. And then if you want to answer any of the others in the chat, please feel free to. So Kerry.
The question from the chat, how important is third level engagement with primary and secondary schools students in AMR outreach? Has it a place?
Does anyone want to answer that one from the chat?
I would like, could you define third level?
I don't know who wrote that one, if you want to pop it in the chat.
Donna's raised her hand.
Donna.
I didn't ask the question, but can have a go at responding if you like.
Oh, I think we've just got an answer in the chat. So university. So they mean how important is engagement with university? Okay. Yeah. So Louise, I don't know if you want to take that one quickly.
Yeah, from a lecturer point of view, it's from teacher education, it's very important. Because this is where we've got a little disjunct with what's going on globally with our climate and education to what's being delivered within our universities to our teachers. And we definitely need to empower our teachers within this aspect. From a primary school point of view, you have to remember that each teacher is covering all the subjects in the curriculum over the time that they are training, and they're only getting snippets of very good snippets, I hasten to add, of aspects of the curriculum. But that idea of the interconnectedness and the interdisciplinary learning is an incredibly important foundation for delivering that to teachers, for delivering into schools. So what we're finding is that we have young people that have a better vocabulary and knowledge of the climate strands, of the sustainability strands in the circular economy than the teachers delivering in schools. So there is a disjunct there.
Amazing, thank you, Louise. Cleo.
Yeah, thank you for clarifying that that question. Yeah, I think it could be really interesting and really important. I think one of the ways I was understanding that question was about, could people in university education go back into schools and work with the schools and young people there? And I think that could be a great way to build that engagement and get almost peer learning happening, just someone that's just one stage ahead that can come back and I think as well, the kind of added benefit for that, particularly people at PhD level or early career who are hoping to see themselves in academia for the long term, to kind of just build those education and engagement skills into their academic career is so important for all subjects, but particularly things like AMR. Just having that connection to what's happening in schools and communities can really strengthen the research and can strengthen and scaffold the education in the way that Louise was explaining. So I think there's quite a few opportunities there for looking much bigger picture at the whole education journey.
Yeah, absolutely. Thank you. And then Mimi, over to you.
Yeah, just to quickly mention some of the resources we have at WHO, because we're looking at the entire educational system. While I focus on the primary and secondary levels, my colleague Philip Matthew also looks at tertiary education. And in 2018, we developed a competency framework for health workers education and training, and that followed with a curricula guide. And also just recently, a couple of weeks ago, we released a curriculum assessment tool so that universities can actually look at the medical education curricula and assess and improve, create a plan to improve it. So that's available, and we're also planning to follow up with a tool for nursing education and pharmacy education. So excellent question. And we can share those maybe in the chat if that's helpful. Thanks.
Yeah, that would be wonderful. Thank you. We're probably at time, but Louise, did you want to just say
Yeah,
something?
I did. I was desperately trying to put my hand up so that I could speak. I think it's really important also to remember that it's been a long time since we were learners in a school setting. And what happened when we were at school is very different to the way that young people learn today. And I often find that learning is produced from people outside the profession that is often what they experienced. And what we're finding more is that young people want to co-create their learning. They want to ask the questions. They want to design the way that they're going. So as teachers, you become more a facilitator. So having more facilitative tools is really important. And the same for those people, if we're having university specialists coming into school, that they get a feel for what is happening within the learning, and then they can build from that. And I think it's often that we come in with a form of knowledge and experience of our time and not of the time of today. And I think that's something I've been involved with the DFE and Learning for Sustainability Scotland, just talking around some of these areas. And we have a vision of what school was like for us and not what it is like for young people today.
That's such an insightful point. Thank you, Louise. And I know certainly at Fleming, we really try to keep co-design and engagement at the heart of what we do. I'm going to wrap up the panel there. So thank you so much for your time. It was amazing to bring the three of you together and have such a broad range of expertise. And I think that discussion really provided some useful tips, but also quite inspiring, and hopefully will galvanize people to want to work in this moving education and AMR related education forwards in the future. I'm just going to hand back to Alison to just give us some closing comment, and then we'll wrap up the webinar.
So thank you very much, Kate, and thank you very much to the completely inspiring panelists for their expertise, their insight, and also so as well as learning so much, there was so many kind of practical, tangible things that were shared just now that we must absolutely acknowledge and learn from. So not only was that inspiring, there was some really, really useful learning, incredible examples shared that we must build upon. And I think, as you know, as Mimi said, that this is now part of the political declaration and commitment for actions to address AMR. So I think it's going to be so important that we learn from all the existing activity that's already taking place and make sure that we learn from experts in education and experts in earth stewardship, and also the best experts themselves, the young, to influence and shape this. And I think going forwards now, it's going to be critical that we gather and learn from what is there and what is existing. And I'm really pleased to say that there is going to be a review of what is going on across the world and how we can kind of bring this together and understand it so that we can collectively develop actions to address the declaration around embedding this in primary and secondary education. I'm delighted today to have all the participants and the experts contributing, and I feel we are all colleagues across the world. And I also want to thank the WHO for their support I'm going to hand back to Kate in a moment, but I think this is an incredible start, bringing people together and learning from the incredible work that's already out there. So thank you all very much indeed. This is only the start, and let's get going and learn from each other in terms of bringing all this amazing work together, and also bringing all the aspirations of where we would like this to go together. Thanks so much. Back to you, Kate.
Thank you, Alison. And yeah, just to echo, thanks to all the speakers and participants for a really insightful morning. And certainly I'm looking forward to being part of the Fleming's work on the review of education and working more with all these partners in the future. The recording of the webinar will be shared online, and I'll get back to everyone about whether the slides can be shared. But just to say once again, thank you for joining us, and I hope you have a wonderful rest of your day.